Our discussion is going to highlight the professional and lived experiences of our panelists and lead us towards some potential actions and some solutions that we can implement here in our community. So first, I'd like to introduce Bianca Nash-Miote, the owner of Birth Queens and Milk Queen, equipping families with the skills to have a safe and happy childbirth and breastfeeding experience. Bianca is an internationally board-certified lactation consultant, birth and postpartum doula, and child passenger safety technician. She is also a program coordinator and instructor for the Common Sense Childbirth Institute. Welcome. Our next panelist is Tamika White, the founder of Lacked Power, which is a grassroots effort to empower Black families in the birth and breastfeeding spaces. From the city of Benton Harbor, Tamika is a certified lactation specialist and doula consultant with a passion for community building, improving maternal and child health, mental health, and health equity. Welcome, Tamika. The third panelist I would like to introduce you to is Carissa White, also a Benton Harbor native. Carissa is a mother of 5 with experience as a breastfeeding peer counselor, facilitator, and teacher. She believes knowledge is power, and providing health education to every mother, father, or supportive person plays a crucial role in improving the health outcomes for mothers and their babies. Our final panelist this afternoon is James Gunter, the executive director and co-founder of Present Pillars. Present Pillars is a fatherhood organization designed to support families through responsible fatherhood. A dad of 2, becoming a father revealed to James how important fatherhood is to the vitality and overall health and well-being of a family. So please welcome our panelists to the stage. So just one more reminder about how you can submit questions. We do have a series of questions we'll talk through. If time allows, we will be able to get to questions from the audience. So using the same link, submit the questions the same way we did for Dr. Lewis Johnson's presentation. So we're going to dive right in. And Bianca, I want to start with you. A mantra in public health and the community health field is nothing about us without us. And that's to ensure people are involved in developing solutions towards issues they face. Can you tell us about some of the ways we can center the experiences and voices of Black mothers in these discussions about breastfeeding and maternal health?
Yes, absolutely. First, I want to thank you for inviting me to come and be here and speak. I just want to set this tone by saying it's important for us to change the narrative. We don't need saviors. We need to be allowed to save ourselves. So with that, it is important that community voices are leaned into and allowed to speak out and have space, and not just space, but a safe space to come and talk. Leaning into those folks who are doing this work already, the grassroots that are here in the community, getting an understanding of what the actual needs are of the community from the community. So centering the community voice in as many ways as possible. That can look like creating trusted advisors. So folks who you have partnerships with, and I know that that's something that Corewell already does, but also that can look like having town hall meetings, allowing people a safe space to come and talk about some of the experiences that they've had and some of the simple ways that they see things can be changed. It can look like listening sessions. So a listening session can be hosted or it can be conducted during a prenatal appointment. And it just means having a safe space for a person to go and talk about an experience that they've had. So that can be with a community health worker, it can be with a doula, it can be with an OB or a midwife, but typically we want to keep somebody outside of those medical professionals who they have to have that interaction with after that point. So a community health worker, a doula, a social worker, someone who they can sit down with and talk about their experience. And this can feasibly be done while they're waiting in the waiting room for their appointment. So it's not something that we have to have them come in at a special time for. Rather, while they're sitting in that waiting room, we can take advantage of that unused time and space. And we can say, hey, would you come and tell us about your experience here? And those are some ways we can definitely allow people to save themselves and have their voice be heard. Thank you.
Yeah, definitely appreciate that. Some good things there. Tamika, would you add anything to that?
Yeah, really great response. Just to kind of piggyback off some of the things that she said, in experiences with providers, a lot of times you don't see a social worker until like the finger is being pointed at you about something. And I can share a personal experience where I was not satisfied with my OB care. And at 26 weeks, I decided to change providers. I had not seen any social worker until that day. And so at that point, I'm feeling like, am I in trouble? You know, did I do something wrong? And this is like 2021. Like I have education and background in being a doula and a lactation helper. And so just imagine what our community experiences. And I just wanted to say that in order to be an advocate or to help people of color or Black women with breastfeeding in general, you have to challenge the way that you look at centering. Right. My experience with centering has been like, okay, your tables are all round. So this is a good way to describe it. The center of your table would be the breastfeeding person or lactating person. Right. And each person on that table has a direct line from the center. And each person at the table, you're providing something, some resource or type of care. How do you operate with the person in the center? Right. Are you creating things and pushing it to the center? Or are you allowing the person in the center to use that direct line to you to move forward what they need? Right. Also, I would like to see a value put on qualitative data. There's a lot of quantitative stuff that don't take into consideration people's experiences. Absolutely.
Those are excellent. I love that visual of even once you have the woman in the center, it's what direction are things flowing? Right. So that's an excellent point. James, I'd like to toss it to you. You feel so far away, but down here. But, let's hear a little bit about fathers, because it is incredibly important. It is incredibly important that we center the Black mothers, but there's also a very incredibly important role for Black fathers. And oftentimes they're invisible to some of these systems as well. So do you want to talk a little bit about the role of Black fathers and how our community can help them engage in the ways they want to and need to?
Absolutely. First, I want to say thank you. It's an honor to be here and actually be able to speak to how Black fathers can be engaged and how we could better advocate for our partners and babies. I would just start by with my own experience. My daughter was born at the beginning of the pandemic. So I can't attribute my experience there to were they overwhelmed with the pandemic, or was I just invisible? So nobody really asked me questions. Quinn had a mini crisis, but like when I spoke up, I was kind of ignored. And she's not in a space where she wants to say, or, just talk about anything other than, hey, get this baby out of me, I'm ready. As the father in this situation, as her partner in this situation, I don't think there's a greater advocate in that space. And the fact that we're ignoring her biggest advocate says a lot about what our intentions are. Mm-hmm. So move along to my son, where I kind of was already in this flow of present pillars. And now I know how to advocate, not just for my voice, but also for her. So I was able to speak up more, and I was able to say more and say, hey, look, I said, that's not what she wants, right? Even though I had an incredible experience with my son's birth, we had an incredible experience with my son's birth. The fact that I had learned how to advocate was everything, because before I was terrified. I mean, not only are we dealing with this pandemic, but this is my first time being a dad. I'm in Florida. I'm away from my support system. My dad can't come and be hands-on with me, right? Which I would have loved. So starting there and then moving forward to just simple acknowledgement. Acknowledgement gives you the confidence to say, oh, I do have a voice. And for a dad, that's huge in that space, because we don't know what we're doing. We don't know what we're doing. So a lot of this is us learning on the go. I get the privilege of speaking to a lot of childbirth education classes, just to dads, when we separate, and that's always the common thing. Our co-founder of Present Pillars, he actually wrote a book that says, "I don't know what I'm doing," to paraphrase it. I take it you guys are familiar with that book. But to me, that really speaks to what a lot of guys are thinking. If nobody's telling me, if I don't have community to reassure me or like let me know that, hey, you're just stay present, right? You're getting it right. Just stay present. Then moving forward to intentional interventions, which I believe Present Pillars is. Just figuring out like, hey, what do guys need? What don't we know? Is it education? Are we building community? Are we giving relief? Is it mental? Like, what is your barrier so that you can better support your family and not create additional barriers for them? And then finally, like I've been harping on, teaching advocacy. How do you advocate in that space? Dr. Sakita was talking about, I can't remember the name of it. I actually asked Bianca what was the name of it, but was it cardiomyopathy? I had no idea what that was, right? But that's something the dad should know. Because who's going to see it first? Not the baby, right? So I'm the chief advocate again in that space. So if I don't know what cardiomyopathy is, I might just think her feet are swelling, right? And I don't know that I need to get her to the doctor or, hey, I don't know that's dangerous. So teaching those things and how to properly advocate for mom and baby is critical.
Thank you. And I love that point that just acknowledging the father helps him find his voice.
Right.
That's an important takeaway. Carissa, I know you've had a vast support network during your time as a mother. Is there anything you would add about how supportive people besides fathers can get involved in supporting a woman through either pregnancy, delivery, or breastfeeding?
Well, I think before they, we kind of tell them how to get involved, we need to let them know that they are essential. We need to let them know that they deserve to be seen and heard. There have been plenty of times that I've experienced where a mom and her supportive person would come into the office for an appointment, and sometimes they were asked to sit out and wait in the waiting room, or sometimes when I would be in the room doing observations, the clinician would just be so focused on mom. And, the supportive person would kind of sit in the background and, you can tell by their body language that they were uncomfortable in that situation, and they don't deserve that. I know we put a lot of focus on moms and babies, but the truth of the matter is that it does take a village to raise our children. And the importance of that village is to rally and advocate also for mom and for baby. We can't do it alone. And I know that, there's this thing going around where, women are, we're empowering ourselves and we feel like that we can do it on our own. But the truth of the matter is that's just not true. Like, we need community. We need each other. So I think that the importance of them being engaged starts with educating the village, educating the supportive person, and letting them know that they can be empowered to rally for this mom and advocate for this mom as well. So I think that's important.
Yeah, when I think of the imagery Tamika provided, again, with the woman at the center and everybody else at the round table around her, as service providers, we got to make sure we know who mom has invited to the table.
Absolutely.
And recognize that. So yeah, so Carissa, do you want to take that a step further? So there's supportive people that might be our personal people, family, friends who we're inviting, but we know there's also a lot of community organizations that are engaged in supporting women and moms in these times. Can you tell us a little bit about what it looks like to have culturally relevant and equity-focused lactation support and education from those community resources?
Well, I mean, in my mind, I would love to see an influx of lactation support in our community, especially as in the Black and Brown community. When I think about just my community as a whole, I don't see a lot of like coming together of breastfeeding support groups that are consistently happening. I know Tamika has been doing a lot with Lack Power, and that's great, but I think it's going to take more than just one person doing the work. I would love to see a place in my community where a mom who may be struggling postpartum, where she can come and there's a safe space for her to share her concerns, to maybe get educated on things that she may not understand. I would love to see it not placed outside city limits, but within the city of Benton Harbor, where a mom or a family or, whoever can reach out and touch somebody. And it doesn't take 2 trains, a bus, and a car ride to get to them. And I think when we start focusing on doing the work, getting into the cities and reaching out and touching the people, then we're able to come together and create policies or create functions. I would love to see Black Breastfeeding Week be celebrated, not just among us, but among my city. I would love parades. I would love, things that really show representation of how important it is for breastfeeding and how important it is to come together and change the stigma. Because I think a lot of things are done in silos, and that's not really getting the word out the way that it should be. So I would love like a community resource center for moms, and I would just love to see more of that in our community. And there are some that are doing that, but we could always do better.
Yeah. What about some of our other panelists? What would you add to Carissa's vision?
Well, I think the delivery process is just one stage of that advocacy that I spoke of that fathers can learn. So I also alluded to the fact that barriers that a father is experiencing as a man can lead to barriers for his family. And one of those that I've heard of when it comes to breastfeeding is a father's ability to cover all finances. Right. So one of the big reasons why Quinn could breastfeed the way she did is because she didn't have to worry about rushing back to work. And then the hurdles that she would have to go through the pump and store and make sure baby had this. And what if he ran out of milk while she was out? So the stress of that wasn't there. And I think the personal barrier that a father could be experiencing financially, whether that be him being underemployed or he can't find work, or maybe his record is preventing him from finding work. If we can find ways to mitigate those barriers, I think that we could really move that needle forward on how much dad could advocate and support mom, thus making it easier for her to breastfeed.
I can just jump in here. When I think about culturally relevant and equity-focused lactation support and care, I think about lactation support and care that seeks to understand the historical context of why Black and Brown people may have trouble with breastfeeding. The intergenerational trauma and the principle that came from the wet nursing that Dr. Sakita Lewis mentioned, that's something that I like to talk about a lot, because in order to understand something about a group of people, we have to understand their history. So understanding history is important. Having representative care is important. So when you have a predominantly Black and Brown community, you need to see Black and Brown faces. That's necessary when we're talking about equitable care. When we talk about equitable care, I think about education and how education can empower folks to be able to get back in the driver's seat. I like Tamika's analogy. I also use that same analogy when we talk about centering the birthing or the lactating person, making sure they remain at the center of their care and they're in that driver's seat. It's important for them to be educated. that education is not hard for them to receive and to have access to. And it is up to us as providers to ensure that they have that. We don't know what their health literacy may look like. And not having an understanding of what their health literacy is, we need to provide them with the access to information. That looks like when they present for that prenatal appointment, let's hand them a tablet. Let's take advantage of that waiting room time. You'll hear me say this time and time again, because it's a feasible solution that we can utilize, and it's quite cost effective. There are already platforms that have educational materials that we can give to our patients, and we can say, hey, here's a video that you can watch with your baby while you are sitting waiting to be seen by your OB. Right? It doesn't have to come after. We can provide them with classes like James says that he teaches. We can provide them with that before, but we can also provide them with that while they're in the waiting room, while they are going through different things. We can provide them with information and access to resources to be able to meet them where they are and meet their needs at that time. Thank you.
Yeah. So, I mean, you all have cast and contributed to a very beautiful vision there of what this could look like. And I detect in some of the framing of how you said those things that we've got some of it in place, but maybe not enough, or maybe not to enough of a broad enough magnitude. Do you think that's an accurate sentiment?
Yeah.
Yeah.
I would definitely say there are foundational pieces in place that can definitely be built upon.
Yeah. Are there any other specific things that we do have in our community, some resources, part of that foundation to build upon, that are particularly innovative or particularly effective, even if they're happening in small pockets, that anybody wants to raise up?
For a small community, there is a plethora of grassroots organizations that are willing to mobilize and do the work. And I think it's just about tapping into them and funding them and letting them go and do the work.
Yeah.
And I would also like to add that there are the infrastructure is not there, but the bare bones is there. Mm-hmm. And I'm even seeing some of my doula clients are in their third trimester attending their friend's birth. Mm-hmm. And so what I would like to see is investment into the people that are already there, to allow them to be skilled, not just to serve, but to be skilled servants of their own communities. The cultural awareness piece is bringing people from somewhere and teaching them how to help these people when we just need access to education, to funding, to programs, to the right people to point us in the right direction, to even know, I learned about peer counselors at the Berrien County Youth Fair. What if I had not gone to that fair? You wouldn't even see me sitting here today. So there are people that could benefit just from being trained and acquiring skills, because we need more. We need more people. I love what I do with Lacked Power, and I love the model that we have, but we need support. We need more people. We need investment into our community. And when I say community, I mean a place and a people. I think sometimes there is a thought of a community as a place. And we also have to accept that everything that Dr. Lewis Johnson said is the truth about the history, the continuation of all of the wrongs systemically. And when we're talking about systems, they were created in a way, but whenever we're talking about tearing down systems, it's all of a sudden my necklace got tied into a knot, and it's going to take forever to untie it. It was created in such a way. So let's look at how it was created, and let's look how to tear down a system. There are children that will tear up things because they are curious about how it was made, and so we know how it was made. So let's tear it down.
Absolutely. Yeah. Well, so on that note, and especially with the context of Dr. Lewis Johnson's presentation, we know that there's all sorts of policies, both capital P policy in the form of law, but also small p policy in the terms of how organizations choose to operate The policy influences what services and resources are available, how they're delivered. What types of policy changes do you think we should, as this village, what should we be advocating for? I guess specific to breastfeeding in Black maternal health.
Right, right.
And to piggyback off of what James said about his partner, I couldn't remember her name, Quinn, having success with breastfeeding based off of the fact that she was not in a rush to go back to work.
Right.
In peer counseling, it was always the tone of the conversation of how do you plan to feed baby is like, I got to go back to work. And so the initiation rates vary depending on how soon you have to go to work. Some people feel like it's not even a reason to start. Like, what is the benefit in even starting this? Because there's a learning curve. And even with myself and being certified in lactation, it was 6 weeks before breastfeeding went good for me with my second baby who had a tongue tie. So I had a learning curve, and I had the benefit also of not having to go back to work right away. And so I had time and the privilege, to learn in this situation. As for policy, I'm not a policy expert, but I am learning policy. And so capital P policies that I have learned about recently is the policy Family Leave Optimal Coverage Act. And this is for all care providers and a benefit that will allow for 15 weeks of paid leave. It's not necessarily paternal or maternal leave, but it's a guaranteed leave for any care provider. Also, I can be a little, my word is escaping me, but I am a proponent of universal basic income. And with universal basic income, families that are struggling can be propped up. And then you can also have the privilege of being able to stay home with your children. In my opinion, the childcare system is not in a great space. And also some of our policies and regulations are punitive in that a person can receive government paid check for babysitting my kids. But as a low wage earner, I cannot also get that same $6 an hour to take care of my own children. Who loves them? Me or that person. And so I feel like I am abandoning my children into the care of someone who doesn't love them when the resources are there.
They are.
Give me the $6 an hour. Why not? And also guaranteed paid maternal and paternal leave, because right now you have to apply for it, and anything you apply for is not guaranteed.
Right.
Yeah. What about some of our other panelists? You want to jump in?
I was going to say to piggyback off of what Tamika said, as far as like going back to work, just in my experience, I think that because moms are, we're in this space of we have to make sure that we're taking care of everything. We're the nurturers. And sometimes we're the breadwinners in our families. And we have this idea of, I have this baby and now I have tunnel vision, and now I have to focus on, how do I provide for my baby? So then in my mind, I'm feeling like, I have to hurry up and go back to work because that's the only way that I know how to take care and support my children. And I just think just the emotional weight of that robs mothers so much of that time that they can be spending nurturing and caring for their baby, because they have so many other things in their minds. And so we do rush back to work. And then when we get back to work, especially in my experience, work can be crazy. You could be working long hours. And then, like Tamika said, the rate of breastfeeding drops, because now you're so consumed with life once again. And so I just think that as far as policy go, I'm not a policy person either. I don't really know. But in my experience, to be able to have that time, have that paid time, where you don't have to have those stresses of life. Because, I mean, having a baby it changes your life. And sometimes, you don't have that time to stop and just take in what just happened to your body, what just happened to your family. And so just allowing them and giving them that time to spend with their families and and recognize what their new normal looks like, because we don't have that time sometimes to stop and recognize that. So definitely would advocate for the paid time for moms and fathers, because, I mean, let's be real, like, they are there to assist too. And sometimes they feel like, well, they have to go back to work, but sometimes we need the fathers, to step in while mom may go take a shower or something, so we need those supportive people to be able to be there with us as well.
Yeah, so definitely hearing this theme of some of both the financial freedom to make a choice about how much time to be at home with baby or responsive to those needs. And we also know that that's just not an absolute reality right now for everybody. Right. There are workplace policies and laws in place governing breastfeeding women in the workplace. Yeah. But it feels like that might not be either complete or always enforced or understood. Yes. So anybody want to?
And I can speak to that. So I can speak to the big P and the little P. So first I'll start off with the big P. I think that it's important for health systems, since we're here on behalf of a hospital system, I think we can speak to that. So it's important for them to understand things like the Pump Act and the Momnibus and things like that and what's incorporated in there. But not only understand it, but incorporate it into how they treat their staff, because the care starts from the top and it goes down. So you can always tell when people aren't treated well at their job because they don't behave very well. How can we ask people to value breastfeeding if they give birth at a hospital and they don't have a place to go breastfeed, or they don't have a place to go pump for their own baby, right? So what does that look like in-house? Do we have rooms for our staff to go and express? Do we have a refrigerator for that milk to be stored in? Because when they feel valued, they will value that and they will hold space for their clients as well. So understanding the Pump Act and what that looks like and how now the right to be able to express is legally protected, right? And then also when we look at, so I also see clients in the community, and one of the most prevalent questions I'm asked, or the most prevalent problems that a client has, is they're returning to work. And usually it's in a healthcare setting. They're not allowed the relief to be able to go and express. And they're like, what do I do? How do I keep my milk supply? Right. So we have to remember to protect our own so that they can, like I said, hold space for others. Right. And they're more likely to do it, because think about your experience. If you're saying, hey, I didn't have that opportunity, so I don't know what to tell you, the way people view lactating and breastfeeding people can change dramatically if they feel safe themselves. Then when we talk about little P and those hospital policies, one thing that I think is really, really important and a feasible, really easy step that can be taken is adjusting the standard of care and deviating from the norm of the standard of care. So we have these check boxes that we have to hit. We have all these things that we have to do. But in those things, we don't seek to meet our clients where they are. Right? It's a standard and it goes throughout the board, no matter what. It's very broad, no matter what someone is going through, no matter where they live, no matter what their social or structural determinants of health may be, there is a standard of care that provider is going to come in the room and is going to shoot at them. And what if that goes over their head, right? What if that doesn't meet them where they are? So I think that we need to look at that standard of care. We need to adjust our models. We need to adjust our policies to meet people where they are. And I just want to give a simple example. So bedside manner, instead of standing up over your clients, let's sit down. let's sit down and let's talk to them eye to eye, right? So that they feel like they matter and they're not being lorded over. Have you ever had someone stand over you and talk to you and you're like, and you're like, okay, I hear you, sit down and talk to them. Let's make it a conversation. It's a two-way street. We talked about censoring them. This is their experience that they have to hold on to for the rest of their life. Compassion, care, these things matter. And even when we look at burnout, and even when we look at a lot of the providers are coming on the back end of COVID, and that really burned a lot of people out. We have to figure out as systems, how do we rejuvenate our staff so they're able to go back out there and give that quality care? It's really it needs a multifaceted approach to be able to make the changes necessary to be able to meet needs and change the narrative. Thank you.
Yeah, a lot of concrete things there. Yeah, James.
I just wanted to highlight the fact that not only are these professionals in this space, but they're also Black moms. And one of my favorite mentors, he loves to say this thing where those closest to the problem are closest to the solution. So a lot of the answers are sitting at this table. And I think going forward, even beyond this conversation, how do we censor their voices, specifically their voices? And this work, because like I said, not only do they have the technical know-how, like they know their stuff, right? But they also have the experiences. So I hope I can see the three of you a lot in these spaces soon. And I also wanted to respond to Carissa, or add to Carissa's statement. So when I got paternity leave, when my son was born, it made me a better parent even to this day. Because in those 2 weeks, and even though it was only 2 weeks, and shout out to the Boys and Girls Club for that, because I wasn't expecting it. But in those 2 weeks, I learned exactly when Quinn likes to take breaks, what she prefers for this or that. I learned a lot about my kids as babies. So in those 2 weeks, like I say, even to this day, there are things that happen where I can walk into the house and just fall into the rhythm.
Yeah.
And if I didn't have those 2 weeks, I wouldn't be able to do that. And then we also know that a lot of times families fall apart in that postpartum period. So a dad having time to really acclimate himself to his family in that space too is a really big deal. So even if it's only 2 weeks, that's a great starting point.
Absolutely.
Yeah, that's a great point, especially with the fact that postpartum period, there's a lot of added stress with all sorts of change to everything. That's a vulnerable time for families.
Yep.
Yeah.
And everybody says, what's wrong with the Black family, right?
Yeah.
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 You added a new person to your home, and you don't have time to bond. And then the dad feels stressed because he might have to pick up another job for mom to stay home. And now he's looking at them like little freeloaders. And she is working 3 jobs because she's the mother,
right,
the house cleaner, she's nursing, and the cook. And it's just, we deserved more.
And real quick, before you jump in, James, if anybody has any questions, we haven't received any questions for the panelists yet. So we got just a few more minutes to make sure you get those in, but go ahead, James.
And for accountability purposes, as dads too, we can't ask more questions. I think we as dads, and I want to say this publicly, we kind of regress and say, well, I don't know. Well, ask a question. You do it for everything else. So we can do it for this too.
Yeah, that ACT model we learned about, ask until you actually understand. I mean, and all those other components can apply for support people as well.
It's life and death.
Yeah.
Absolutely.
All right. Well, we're going to wrap up this panel a little bit. We're not getting too many questions from the audience. I think you all have covered things really well. But I'm going to give each of you an opportunity to share one key point. If somebody remembers just one thing from this panel discussion, what is it you want them to walk away with? So who wants to start us off?
I guess.
Yeah, go ahead, James. Floor is yours.
So if I was to give one sentence that I wanted people to walk away with, is this is a all hands on deck type of situation. In my opinion, we're talking about life and the fact that Black moms are dying at 3 times the rate. I think that's what I saw in Dr. Sakita's presentation. So to me, it's imperative that we start to look at it as people. and humanizing, and really, this isn't a sentence. But all hands on deck. That's what I would say.
It's just a long sentence. We heard it. Yeah.
I had
Thank
to
you.
check myself.
Mine too, so I don't.
Carissa?
I think one takeaway that I would want people to kind of take with them would be, like Dr. Sakita said, like we've done a lot of talking. We've had conversations. It's time to put some action behind what we're saying. And I don't feel like that it needs to be slow action. I think that it needs to be expedited action, because the fact that we are losing more Black women should be enough to make change happen instantly. And I know that we may run across barriers. This is not a sentence as well, but we may run across barriers. But we need to continue educating, and we need to keep empowering our community, and we need to keep coming together so that these things can be changed and that we can see more healthy outcomes for Black maternal and infant health in our community.
Yeah. Thank you.
I'll go. It's all about investment into our communities and understanding that there was disinvestment into communities, into places, and into a people. And it's going to take investment. And also the word I was looking for with the capital P policy was radical. And so I can be a little radical, but also as far as the universal basic income goes, there are 43 US cities doing it. So it can be done.
Thank you. Bianca.
Yes. So mine is also a closing statement. I am going to end the way that I began, and I'm going to say Black women do not need saviors. We need to be allowed to save ourselves. Black women need to be seen. Black women need to be heard, and Black women need to be believed. That is so important. The final thing I'll say is Black women and Black babies should be viewed as a human rights violation. I'm sorry, Black women and Black babies dying should be viewed as a human rights violation. It's not okay, and we need to move, and we need to act now. We need to make the changes. Thank you.
And because we know repetition is so important, to summarize, this is an all hands on deck situation because we need quick, expedited action. Can't be afraid to be radical. And we've made investments and we have outcomes. Now we have an opportunity to make different, maybe larger investments to get different, better outcomes. And this is not a charity case. It's not in need of anybody rolling up on a white horse as a savior, but it's creating space and resources for people to act within the power they inherently have and the value they inherently have, to be heard, to be believed, and to act. Yes. So thank you all so much for being here. What a pleasure and an honor for me to be here on stage with all of you. Grateful that you have shared your wisdom, both professional and lived expertise. I know it's been of value to our community. So thank you.
Thank you.
Thank you.
Yeah.
All right. All right. So you all are welcome to step down. And at this point, I'd like to invite Dr. Lauren Hamill, the president of Corewell Health in Southwest Michigan, to the stage. Thank you, Dr. Hamill, for joining us and sharing a few words with us.
Thank you very much, Nikki, and to your team for planning this really valuable event. Thank you for letting dads and even granddads into the room. I appreciate it as well. I'd like to thank Tamika and Bianca, Carissa, James, for not only sharing your really important experience, but also your hearts on this topic. That's also important to see, your compassion, your commitment, your passion related to this is really obvious and is incredibly important. Doctor, that was an amazing presentation. Thank you for sharing as well. You started out by doing an assessment of kind of the emotion in the room. The emotion in the room, I don't know about all of you, but the emotion in the room when we're done. I mean, there are a lot of things that come to mind, that come to heart, including things like sorrow, like heartbreaking, certainly like remorse, but also motivation. And, I hope you understand this, also inspiration. I think it's really inspiration to really make a difference. I don't have time to tell you all the things that we're thinking about and that we're doing related to this topic, but let me just give you a few maybe quick comments. One is, this is a key corporate goal. This is not just something we're thinking about. This is something we intend and are acting on in very deliberate ways. What better way to invest resources than saving lives? I can't think of one. And what better way to save lives is with the youngest lives and their mothers. I mean, that is just, it's kind of like the top of the top. I want to save grandpa that's 85, but to save a baby as they're entering this world is just unbelievably important. And we are completely committed to do that. Committing the resources, the talent, and the funding is certainly part of it. But listening to the stories, and you raised the bar for me, I can tell you, when you talked about, kind of listening to stories. If that's not an active process, you're actually silencing voices. We've learned that other ways, but to just remind ourselves, this is not about a comment box. This is not, a survey that you send to a home. This is actively going out and listening to those stories. I'm also listening to experts like you. We're committed to do that. Certainly, Nikki and her team is committed to do this longitudinally over years to make sure we're bringing those experts and we're listening to those experts. We also completely committed to listening to our community as we have described and are doing that in many ways, but there are more than I can think of. The one that made me a little nervous, I'll just tell you, we have 50 some locations, and I'm thinking, how can I put refrigerators in every one of them? You made me sweat. Well, thank you so very much for coming to this important topic. I really, really appreciate it. We are together going to save lives because of this effort, because of this meeting, because of these commitments. We're going to save more lives, and that's something that's going to bless our community. So thanks very much.
I don't know if we'll step in front of the podium for this one, but, I agree. This has been such a wonderful experience. It feels weird to call it wonderful. There's been such a range of emotions and thoughts, but really impactful. I know that expedited action is required. And, when Dr. Sakita said in her presentation, how did you feel when you were looking at those headlines? I felt really mad that the same headlines from when I was a child are still the headlines right now. But right now we're in a moment where we can stop that cycle from repeating. So again, Corewell Health, particularly here in Southwest Michigan, we are very committed to doing what is in our control to act on these things. We've jotted down lots of notes, and we'll make sure we're reviewing everything shared today. We also want to make sure that we are continuing that dialogue with our community. We know change doesn't happen in a day. Change doesn't happen because we had this summit where we learned a lot and connected in a lot of ways. But we also know our journey doesn't end here. You can continue to engage with our work. We're going to continue to have more ways to do more listening sessions. We'll have to figure out more of the details of what that looks like, but we want this to be very intentionally ongoing dialogue. And I'd be remiss if I didn't also mention two things. We have the Center for Better Health that is located in downtown Benton Harbor. We're currently at 100 West Main Street. It is a very small but mighty facility that is doing a lot to serve a lot of both social and health needs for the residents of our community. If you haven't checked out our facility, please feel free to drop by Tuesday through Friday. And in November, we will be moving to a new space that is 20 times larger, literally 20 times the square footage. That will be at 133 West Main Street, so just kitty corner across the street. But that space allows us to really expand a lot of our maternal infant health programming. I mean, when we're talking about breastfeeding support within the city limits, well, you know, Carissa, we got a building, we got the space, we're compiling all the expertise, we've got this. The other thing I'll say is that Corewell Health is honoring Black Breastfeeding Week with a whole lot of other activities. This is the second of, I believe, 7 planned events that are happening both in person and virtually across the state. You can find more of this information on the Corewell Health Facebook page, but there are some great events continuing into next week. So if you're interested in learning more, please go check that out. And then I'm going to right now ask everybody to take out your smartphone, scan the QR code for the evaluation survey. And you're not allowed to get out of your chair until your survey has been submitted. We're going to go with the honor system for those of you online. So the link is in the chat for those of you still with us on Zoom. Please be sure. Again, we value this feedback tremendously, and it does help shape future events. So thank you all again for being here.